treatments are pretty drastic and they're actually not very efficient. So you can treat the disease by putting the women on hormonal treatment, by giving the pill. But that's not good in the long term, especially if you want to form a family and so forth. The other way of treating this disease is like removing these lesions that are formed inside the peritoneal cavity.
Surgery.
With surgery. And that could be quite drastic because basically by the time that the women start developing these lesions to the time that they are being diagnosed with the disease, it can be like 7 years in average. So all throughout that time, these lesions are growing and they could be quite significantly big. In that case, the surgery is quite invasive and you have to remove sometimes even the whole uterus. So basically the treatments that are now are quite invasive and they compromise the fertility. So what we wanted to do is do something different. We want to find the first step in the pain, which is the nerves that innervate these organs that are affected during endometriosis. And we wanted to know how that works. We wanted to know how the signal that is being sent at any given time into the brain has changed, and that's why you perceive pain. And we want to be able just to block that signal and then offer relief. By knowing what sort of channels are involved in this process, we can then apply pharmacological treatments and block them. Or by knowing the pathway that they work, we can intervene in different steps of these pathways and then stop that signal from traveling up. That's the first step. But then there is a big inflammatory environment during these lesions, and this inflammatory environment directly affects the nerves, but at the same time allow these lesions to grow. One of the strategies that we are assessing is how to reverse this process by stopping the nerve growing into those lesions. And then we are trying to attack the signal that travel through.
We fix both problems.
We could fix both problems.